Welcome. Today we will be discussing sanitation, the diaper changing policy, and the exclusion policy for our agency. The sanitation policy. The Head Start Center staff will conduct housekeeping activities to maintain our facility in a clean and sanitary manner to reduce the transmission of infectious and communicable diseases. Part of sanitation is making sure that we keep our bathrooms extremely clean and sanitized. So when it comes to bathrooms, they are to be checked by either the custodian or any staff member several times a day. Bathrooms should be cleaned in between classes using the facilities and after the last classroom brushes their teeth. The classrooms. Classrooms will be cleaned on a daily basis. Easy clean kits will be used to clean up any bodily fluids such as blood, vomit, etc. If you need these, please ask your custodian or your health specialist, and they can provide you with an easy clean kit. Disinfecting solution and spray bottles can be used for everyday disinfection of toys, tables, etc. Soap and water will be used once a week to take dirt and grime from toys, tables, etc. Classrooms need to be deep cleaned at least once a week. And with COVID, we will be sanitizing all our materials as they're being used. Diapers worn by children shall be able to contain urine and stool and minimize fecal contamination of the children, staff, environmental services, and objects at the Head Start Center. The use of modern disposable paper diapers are associated with less fecal contamination of the Head Start environment. Therefore, it is the policy of MWNMCAP Head Start and Early Head Start that reusable cloth diapers are not allowed in the facility. Disposable diapers are provided for the children by the agency. On a diapered child's arrival at the center, their assigned teacher will check for wetness or feces. The assigned staff will check their diapered children's diapers for wetness or feces at least hourly or when the child indicates discomfort or exhibits behavior that suggests a soiled or a wet diaper. The child shall be changed promptly when found to be wet or soiled. The following diaper changing procedures are posted in the diaper changing area and consist of the following. First step, wash your hands. Then you gather necessary materials, for instance, a clean diaper, wipes, clean clothing if needed. You put on your disposable gloves. You place your single-use cover on the table. The child is gently placed on the approved diaper changing table. Soiled diaper is removed and deposited in the plastic-lined or foot pedal type covered waste receptacle. The child's diaper area is cleaned from front to back with a clean, damp wipe for each stroke. Once you're done, wash your hands. If you need topical cream, ointment, lotion is applied only when the infant room staff has received written parental consent, okay, or request. This parental permission shall be kept in the child's medical record. Then you put on your clean disposable diaper and clean clothing if the child's clothing is soiled. Child's hands are washed. Infant or child can now return to other children. Single-use table cover is put in covered waste receptacle. Disinfect diaper changing table using 1/4 cup chlorine bleach to a gallon of water, or the sanitation chemicals that you have in your spray bottles. Remove and dispose of gloves, and then you wash your hands. Children shall be diapered only on the approved diaper changing table and on no other surface. The diaper changing table shall be kept in good repair and shall be cleaned and disinfected after each use. The table shall be cleaned to remove visible soil, followed by wiping with an approved disinfectant. Disposable, non-absorbent paper table covers are used at this center. 9. Soiled diapers shall be stored in containers separate from other waste and labeled with soiled diapers. The washable containers are provided with plastic disposable linings and are located within Arm's reach of each changing table. The soiled diaper containers are kept tightly covered when not in use. Diaper containers shall be cleaned and sanitized at least weekly or whenever there is a buildup of soil or odor. The early Head Start teachers will share the duties for cleaning and disinfecting the soiled diaper containers. Soiled diaper containers shall be emptied at least daily or as often as necessary to prevent the accumulation of soiled diapers in the container. Hand washing and hygiene. Hand washing is the single best way to reduce or stop the spread of bacteria that cause a child to be ill. A continuous supply of hand washing soap and disposable paper towels will be provided at each lavatory and hand washing sink. Our staff washes their hands and teaches or helps the children to wash their hands. Staff washes their hands upon arrival at the child care center, before handling foods, cooking activities, or serving food, before and after eating meals or snacks, after toileting self, the children, or diaper changing, after handling or coming in contact with bodily fluid or items contaminated with bodily fluids such as blood, drool, vomit, urine, stools, feces, or discharges from the eyes or nose, or smoking. After coming in contact from outside playtime, after handling pets or other animals, before and after administering medications. 2. Children will be directed or assisted in washing their hands upon arrival at the Head Start Center, before meals or cooking activities, after toileting, after outdoor play, after coming in contact with bodily fluids, and after handling pets or other animals. Hand washing by both children and staff will be done by the following method. A. Soap, warm water, and individual towels are available for staff and children. Turn on water and adjust temperature. Wet hands and apply a liberal amount of soap. Rub hands in wringing motion from wrist to fingertips for a period of not less than 20 seconds. Rinse hands thoroughly. Dry hands using an individual towel. Use hand drying towel to turn off water faucets. If a child is being currently potty trained, teachers will assist the child with all hygiene practices and ensure that all efforts are documented on a diaper changing log or in the observation form. All documentation will be given to the health specialist at the end of the month. If you have questions or concerns, please discuss your issues with your health specialist. If she needs to, she will contact me for clarification on any health policy. Exclusion of children. The Midwest MWNMCAP Head Start centers shall not deny admission to or send home any child because of illness unless the child is unable to actively participate in program activities, or they expose other children and staff to illness, or they are at risk for being exposed to other illnesses when their resistance is low. Procedure. In order to ensure that children and staff are not unnecessarily excluded from Head Start activities and to protect the health of the children and staff, the following actions will be taken. Children exclusion and readmission. The Midwest MWNMCAP Head Start Center will not deny admission nor exclude any enrolled child from program participation for long-term periods solely on the basis of his or her health care needs or medication requirements unless keeping a child in care poses a significant risk to the health or safety of the child or other children, staff, or visitors, and the risk cannot be eliminated or reduced to acceptable levels through reasonable modifications in procedures, policies, or staffing. The Head Start director can only approve long-term exclusion of a child after consultation with the child's parent, guardian, healthcare provider, and the Head Start health coordinator. The following are conditions of short-term exclusion from and for readmission to the Midwest MWNMCAP Head Start centers. Fever of 101, auxiliary underarm or higher, and who have one or more of the following: diarrhea, earache, sore throat, rash, show signs of irritability or confusion, symptoms and signs of possible severe illness such as lethargy, uncontrolled coughing, irritability, persistent crying, difficulty breathing, or wheezing until medical evaluation allows inclusion. vomiting on 2 or more occasions within a 24-hour period until the vomiting resolves or a healthcare provider determines the illness to be non-communicable and the child is not in danger of dehydration. Diarrhea that is increased number of stools, increased stool water, or decreased form that is not contained by a diaper. Mouth sores with drooling unless the healthcare provider or health official determines the condition is non-infectious. Rash with fever or behavior change until a healthcare provider determines that these symptoms do not indicate a communicable disease. Eye discharge or pink eye. Children can be readmitted after medical diagnosis to rule out bacterial infection or 24 hours on antibiotic treatment. Tuberculosis until a healthcare provider or health official states that a child can attend. Impetigo until 24 hours after treatment has been initiated. Strep throat or other streptococcal infection excluded until 24 hours after initial antibiotic treatment and the cessation of fever. Chickenpox excluded until 6 days after onset of rash or until all sores have dried and crusted or with permission by their healthcare provider. Pertussis, whooping cough, excluded until 5 days of appropriate antibiotic treatment to prevent an infection have been completed. Mumps until 9 days after the onset of parotid gland swelling. Hepatitis, a virus, until 1 week after onset of illness or as directed by a health department when passive immunoprophylaxis has been administered to appropriate children and staff. Measles, excluded until 6 days after onset of rash. Rubella, until 6 days after onset of rash. Shingles, herpes zoster, exclusion only on recommendation of child's healthcare provider. Clothing and or dressing shall cover sores until sores have crusted. Children with open oozing sores which cannot be covered will not be allowed to be at the center until a child who has been determined to have a communicable illness will be excluded until 24 hours after starting antibiotic treatment or sores are properly covered, for instance with a bandage or clothing or for staff gloves, or sores have healed. Lice, scabies, and other infestations until 24 hours after treatment has been initiated. If a child must be sent home because of an illness, the staff will place the child in quiet isolation and attend to their needs to the extent that this attention does not compromise the care of other children. The isolation area room for the center is located at the health specialist's office. A child with uncontrolled diarrhea or vomiting shall be provided separate care in the isolation area apart from other children until the child's parent arrives to remove the child from the center. If the center director has concerns about the child's ability to safely return to the center, we will reserve the right to request a note from the child's healthcare provider. When a child is excluded from attending our child care center, the staff will note this in the illness incident report or injury incident report. If you have any questions or concerns, please contact your health specialist at your office, or you can call me on my cell. The number is 1-575-418-8166. Remember, if it's not in black and white, it never happens, so please document any incidents that happen, any health concerns that you have on a child. Please make sure that the notes are taken, that it's covered under your daily health check. That's what those forms are for, so please make sure that you document everything concerning your child's health. Thank you.